Right now, I mean, your social media feed is probably just full of people sharing their sleep cycles, right?
Oh, yeah. Or their morning cold plunges.
Exactly.
Yeah.
And, they're incredibly detailed gut microbiome breakdowns. We live in this era that absolutely loves oversharing about the human body.
We really do. Nothing is off limits anymore.
Right, like we're obsessed with optimizing every single function. And we discuss it all as casually as the weather. But despite all this radical transparency, there is one medical condition affecting nearly 20% of women.
That is 1 in 5 women, which is huge.
1 in 5. And it is still wrapped in this complete suffocating silence. I mean, we're talking about painful sex, specifically dyspareunia.
Which is an immense tragedy, honestly.
It really is. So many people are just quietly enduring this pain, assuming it's just an inevitable part of aging or, a normal reality of postpartum recovery, or they're frankly just too embarrassed to bring it up with their own doctor.
And when you suffer in silence like that, you completely miss out on the fact that medical science is making revolutionary leaps in treating this exact issue.
Yeah.
We are moving so far past the days of just telling women to buy a moisturizer and, well, hope for the best.
And that is the entire mission of our deep dive today. We are answering a very specific question for you. Can intimate polynucleotides actually treat painful intercourse?
It's such a vital question to answer right now.
Absolutely. To figure this out, we're looking at a dense stack of clinical practice guidelines, real-world efficacy studies on vulvovaginal atrophy, and highly specific protocols from specialized women's health clinics.
There's a lot of rigorous data here.
There is. We are going to explore a regenerative treatment that honestly sounds like it was pulled straight from a science fiction novel.
Okay, let's unpack this because we are actually talking about using fish DNA to treat vaginal pain.
I know, it sounds completely bizarre at first glance.
It really does. Like, fish DNA. Yeah, it's completely natural for you to feel a healthy dose of skepticism hearing that. Using marine DNA to heal human tissue sounds like something out of a futuristic movie.
Totally.
But I promise you, when we look closely at the serious medical science of regenerative medicine, the biology we are dealing with here is incredibly elegant and remarkably effective.
Well, I am fully ready to be convinced by elegant fish DNA, but I think before we can understand how regenerative science fixes the problem, we need to understand the underlying mechanics.
Right, the root cause.
Yeah. What exactly is breaking down in the body to cause this agonizing pain in the first place?
So to understand the pain, we have to look at a condition called genitourinary syndrome of menopause, commonly known as GSM, and specifically a symptom called vulvovaginal atrophy.
Okay, atrophy.
Right. Now, while the name has menopause in it, it's crucial to note that this happens to younger women, too.
Like postpartum, right?
Yeah, exactly. Postpartum, during started breastfeeding, or due to certain medications. But the core driver across all these demographics is a dramatic, systemic, biological shift in hormones. We are looking at a severe drop in estrogen.
Specifically estradiol, right? Like the powerhouse estrogen.
Correct. Estradiol is the specific hormone that keeps the tissue in the vulvovaginal region plump, highly hydrated, and resilient to friction.
It's what keeps everything functioning normally.
Yeah. During a healthy premenopausal menstrual cycle, your estradiol levels can peak at around 800 picograms per milliliter.
Wow, 800.
It is basically flooding the tissue with vitality. But during perimenopause and postmenopause, those levels plummet. They crash from that peak of 800 all the way down to below 30 picograms per milliliter.
30, that is a massive drop. I mean, dropping from 800 to 30 is it's like a lush, hydrated sponge being left out in the desert sun.
That's a great way to picture it.
The water just evaporates, the internal structure shrinks, and if you try to bend or stretch that sponge, it just snaps.
That analogy perfectly captures the physical reality at the cellular level. Without that circulating estradiol, the vaginal epithelium, which is the protective surface layer of the tissue, literally thins out.
It just wears away.
Exactly. It loses these microscopic, finger-like structures called papillae. Papillae normally provide a protective buffer against friction, and they give the tissue structural support.
And without them?
Without them, the tissue becomes flattened, keratinized, and incredibly fragile.
Yeah, the clinical sources describe the consequences of that fragility, and it honestly sounds devastating. They detail issues like petechiae.
Right, the microbleeding.
Yeah, these tiny, agonizing microbleeding spots under the surface. And even frank ulcerations, which are literal open sores occurring during sexual activity.
It is a severe physical trauma to the tissue, and it goes deeper than the surface, too. The underlying connective tissues are entirely depleted depleted of collagen and elastin fibers.
So the whole structure is failing.
Yes, and to make matters worse, the entire local biological ecosystem collapses. Healthy vaginal tissue is full of lactobacilli bacteria. These good bacteria survive by eating glycogen, which is produced by estrogen-rich tissue.
Oh, I see where this is going. When the estrogen drops.
The glycogen vanishes, and the lactobacilli literally starve to death.
Wow. And without those good bacteria producing lactic acid, the vaginal pH just starts to rise, doesn't it?
Precisely the issue. That rising pH leaves the entire area totally vulnerable to an overgrowth of bad bacteria, chronic inflammation, and recurrent infections.
So it essentially functions as a complete structural collapse. If we think about the body like architecture, it's like a building losing its internal scaffolding and its mortar.
That is exactly what has happened.
You don't just have a dry building. You have a building where the walls have become completely brittle, and they are prone to cracking and crumbling under even the slightest pressure.
And that structural collapse dictates the specific types of pain women experience. Clinics actually classify this pain into two main categories. First, there is superficial or entry pain. This is localized right at the vulva or the vaginal introitus.
Just to clarify for everyone listening, the vaginal introitus, that's basically the physical opening or entryway, correct?
Yes, the very opening. Patients dealing with superficial pain often describe it as an intense burning, stinging, or like a raw paper cut feeling.
Oh, man.
Yeah, it happens immediately upon touch or initial penetration.
A paper cut in that specific area sounds agonizing.
The discomfort is profound. Then you have the second category, which is deep dyspareunia. This is pain experienced much higher up in the vaginal canal or deep within the pelvic cavity during thrusting.
How do patients usually describe that one?
It is often described as a deep radiating ache or a blunt collision pain. Deep pain often points to internal structural issues like endometriosis or adenomyosis.
And adenomyosis is, that's the condition where the tissue that normally lines the uterus starts growing into the muscular wall of the uterus itself, right?
That is correct. It creates a bulky, tender uterus that causes pain upon impact. However, that superficial burning, paper-cut pain at the entryway is heavily directly tied to the atrophy and tissue breakdown we just outlined.
Right, the loss of that scaffolding.
This raises an important question. If the walls are fundamentally brittle and cracking, why are women universally told to just buy over-the-counter lubricants?
That is honestly the most frustrating part of this entire discussion. The international guidelines do consider OTC lubricants and moisturizers as a first-line therapy.
Mostly because they are cheap, accessible, and have very few systemic side effects.
Right, but they only provide temporary slip. They reduce the immediate friction for an hour, but they do absolutely nothing to repair the underlying biological vulnerability. They don't rebuild that collapsed scaffolding.
Which brings us to the regenerative solution. If we have a massive structural breakdown, and a patient doesn't want to rely entirely on hormone replacement therapy.
Or maybe they can't.
Yeah.
Like perhaps they physically cannot take estrogen due to a medical history of breast cancer or blood clots.
Exactly. How do we command the body to rebuild that scaffolding on its own?
And this is where we finally introduce polynucleotides, or PNs. You'll also see them heavily referred to in the medical literature as PNHPT, which stands for polynucleotides high purification technology.
At their core biological level, polynucleotides are highly purified, highly fragmented residues of DNA.
Okay.
We are talking about precise, microscopic chains of molecules ranging from 50 to 2,000 base pairs in length. And yes, as you mentioned earlier, they are derived directly from the gonads of wild-caught trout or salmon.
I just have to pause and appreciate the sheer wildness of human medical discovery here.
It's fascinating.
Someone, somewhere in a lab, figured out that the reproductive organs of a trout held the answer to human vaginal atrophy. Like, how does that even happen? But why marine DNA? Why not plant DNA or synthetic DNA?
Because marine DNA, specifically from these species, is incredibly biocompatible with human tissue. The extraction and purification process is rigorous. It removes all the native proteins, peptides, and animal cells that could ever trigger an immune or allergic reaction in a human body.
So it's super clean.
Very clean. What you are left with is a pure, biologically active polymer. And their mechanism of action is brilliant. PNs do not just sit passively in the tissue. They work as active biostimulators.
Meaning they are basically chemical messengers. They enter the tissue and actually tell the body to initiate a physical process.
Yes. They seek out and bind to our fibroblasts. Now, fibroblasts are the body's master builder cells. They maintain our connective tissue. But under normal circumstances, if an aging or dormant fibroblast wants to repair damaged tissue, it has to build new DNA and RNA from scratch to fuel that synthesis process. Synthesizing nucleotides from scratch requires massive amounts of cellular energy, or ATP.
Which takes a lot of effort.
A ton of effort. In an aging body, the cells just don't have the energy reserves to pull that off efficiently.
So the PNs offer a biological shortcut.
A massive shortcut. They utilize what biochemistry calls the salvage pathway. By providing these highly purified, pre-fragmented nucleotide building blocks directly into the vaginal tissue, the fibroblasts don't have to manufacture them from scratch.
They just grab them and go.
Exactly. They just absorb these ready-made DNA blocks and immediately get to work synthesizing brand new type I collagen, new elastin fibers, and fresh extracellular matrix.
Here's where it gets really interesting. Because if we go back to our building analogy, injecting these polynucleotides is essentially handing the body's exhausted construction workers, the fibroblasts, both the exact architectural blueprint they need and a massive pile of premium ready-to-use bricks to rebuild the damaged walls.
That's exactly it.
They don't have to fire the clay themselves, they just start building.
Yeah.
And just to define it quickly, the extracellular matrix we are rebuilding is essentially the biological mesh that holds our cells together and gives the tissue its bounce.
That is the perfect way to describe the extracellular matrix. What's fascinating here is how this regenerative approach completely differs from other popular treatments you might have heard of, like traditional hyaluronic acid or HA fillers.
Because HA is everywhere in aesthetics right now.
It is. But if you inject standard HA filler into any tissue, it is a fantastic immediate hydrator. It pulls in surrounding water and adds instant volume, but it is essentially just a temporary biological sponge.
It just sits there.
It sits there, holds water, and eventually degrades. It does not alter the underlying biology of the tissue. Polynucleotides, on the other hand, actively change the behavior of your cells. They wake up dormant fibroblasts and command the body to engage in long-term structural self-repair.
Though the literature does point out that PNs also have a pretty fantastic hydrating effect on their own, independent of the collagen building.
They do, yes. Through something known as the hydrogel effect.
Hydrogel effect.
Right. Because of their specific three-dimensional molecular structure, these polynucleotide chains naturally attract and aggressively trap water molecules in a dense web. So a patient gets this deep, soothing, long-lasting tissue hydration immediately, while the slower, more profound cellular regeneration is happening in the background over several weeks.
I mean, the scientific theory is incredibly elegant. The mechanism of the salvage pathway makes perfect logical sense.
It does.
But as anyone who follows medicine knows, what works beautifully in a petri dish or in a textbook doesn't always translate to the messy, complicated reality of a human body. So, do these fish DNA injections actually translate to a pain-free experience for the women using them?
The clinical data from the real-world studies we analyzed is deeply compelling. But first, we should probably clarify the application methods.
Good point. How do they actually get it in there?
Depending on the severity of the atrophy, polynucleotides can be prescribed as a daily vaginal ovule, which is basically a localized, dissolvable suppository used every day for 2 to 4 weeks.
Okay, so something you do at home.
Right. Or, for much more profound, deeper regeneration, they are administered via clinical intradermal injections, usually spaced out over 5 to 6 sessions.
And the researchers tracking the results of that daily ovule study found some numbers that completely shift the paradigm.
They tracked a cohort of 54 postmenopausal women using the PN ovules, measuring multiple markers of intimate health. And in real-world studies, we aren't just seeing marginal 5% improvements, we are seeing major biological reversals.
Like what kind of numbers?
Vaginal hydration improved by almost 60%, natural secretions by nearly 53%. But perhaps most importantly, for that deep structural repair, they measured the deeper tissue elasticity.
And what they found wasn't just a slight improvement. The elasticity basically doubled. It went up by almost 51%.
Exactly.
Imagine a rubber band that has become completely dry and brittle, ready to snap at the slightest pull. In just a few weeks of using these ovules, these women's bodies were able to restore half of that original stretch and bounce.
It's incredible.
That is the fundamental difference between tissue that tears and bleeds during intimacy and tissue that can comfortably stretch and function normally.
Exactly the biological outcome you want. Furthermore, the superficial petechiae, those agonizing micro tears we discussed earlier, healed remarkably, showing over a 50% reduction in occurrences.
Those broader studies are great, but there was one specific case study in the clinical literature that brought this entirely out of the abstract for me.
Ah, the 42-year-old patient.
Yes. It detailed a 42-year-old woman who had survived colorectal cancer. Because of her intense chemoradiotherapy treatments, she'd been thrown into iatrogenic menopause.
Right. And for those unfamiliar with the term, iatrogenic menopause is when medical treatments like targeted radiation or aggressive chemotherapy forcibly shut down the ovaries almost overnight.
It's not a natural decline.
No, it is sudden, unnatural, and often comes with far more severe symptoms than the gradual transition of natural menopause.
And this woman was suffering immensely. Her dyspareunia score, her self-reported pain level during any attempt at sex, was rated at a 10 out of 10.
Unbearable.
Completely unbearable. She could not have an intimate life at all. But then her medical team put her on a regenerative protocol of combined polynucleotide and hyaluronic acid injections.
And the results were stunning.
They were. After completing a course of 6 sessions over several weeks, her pain score dropped from a 10 out of 10 all the way down to a manageable 5 out of 10. Her vaginal dryness score plummeted from a 10 down to a 2.
The clinical notes simply stated she was able to return to a normal, satisfying sexual life.
It is a profound, life-altering outcome for someone who had already survived the immense physical and emotional trauma of cancer treatments, only to be robbed of her intimacy on the other side.
It really is.
But it makes me wonder about the broader ripple effects. If you were listening to this and you've been avoiding your partner for months or years because you were terrified of the pain, hearing that there's a biological fix that restores that specific connection is incredibly validating.
Absolutely.
If the physical pain decreases that dramatically, how does that alleviate the psychological and relational toll this takes on a woman's life?
If we connect this to the bigger picture, the clinical researchers actually set out to measure exactly that. They used an established psychological metric called the PAIR scale, the personal assessment of intimacy in relationships.
Okay, so a standardized test.
Yes. They asked these women to evaluate 36 different items relating to their relationship dynamics before and after the polynucleotide treatments. Interestingly, the non-sexual day-to-day routine items of their relationships didn't fluctuate much.
That makes sense.
But 5 out of the 6 specific items relating to sexual gratification and intimate vulnerability improved significantly.
Meaning they felt a massive shift in their ability to just be present with their partners. Like statements such as, I am satisfied with our sex life, or I feel comfortable expressing my needs, saw huge jumps in positive responses.
Women explicitly reported feeling less like sex was a painful chore or a routine they had to endure. They felt capable of initiating intimacy without the looming anxiety of severe pain.
That anxiety is so heavy.
It is, and it proves definitively that repairing the cellular tissue isn't just an anatomical victory for a doctor. It is fundamentally about restoring a woman's bodily autonomy, her confidence, and the emotional harmony within her relationship.
To give someone that part of their humanity back is massive. But I want to play devil's advocate for a second here.
Okay, let's hear it.
If a listener searches for treatments for vaginal rejuvenation or painful sex online right now, they are going to be absolutely bombarded with ads for heavily commercialized procedures. How do polynucleotides stack up against the alternatives?
It's a very crowded market.
Right. Getting stuck on the PRP aspect. Like the O-shot, it uses platelet-rich plasma. If PRP uses my own natural growth factors extracted from my own blood, wouldn't my body inherently prefer that over the DNA of a random marine fish? Why introduce external DNA when my own blood is right there?
It is a highly logical question, and it is exactly what patients weigh during consultations. PRP aims to stimulate blood flow and collagen by spinning down your own blood and injecting the concentrated growth factors back into the local tissue.
So it's all natural.
It is autologous, meaning it comes from you.
Yeah.
And some women do see real benefits. But the critical flaw with PRP is that it is entirely dependent on the quality, age, and health of your own plasma at that exact moment in time.
Oh, I see.
If your body is already depleted, inflamed, or aging, your plasma's regenerative capability is compromised.
So you might just be injecting a weak signal back into the tissue.
Precisely. Polynucleotides bypass that variable completely. They provide an external, highly standardized, wildly consistent, biocompatible DNA scaffold.
You know exactly what you're getting.
Yes, you aren't relying on your body's fluctuating, circulating growth factors. You are delivering a targeted, massive dose of the exact molecular building blocks the fibroblasts need, guaranteed every single time.
Okay, let me push back on the biggest competitor in the space then.
Yeah.
Energy-based devices, like transvaginal lasers and radiofrequency wands. If you look at any med spa website, lasers are heavily marketed as the absolute, undisputed gold standard for vaginal rejuvenation. So what does this all mean? If lasers are the gold standard, why are we even discussing fish DNA?
This is a critical area where we absolutely must look at the highest levels of clinical guidance, bypassing the glossy marketing brochures.
Because marketing isn't science.
Exactly. The NICE guidelines, the National Institute for Health and Care Excellence in the UK, which sets rigorous medical standards, they conducted a comprehensive overview of transvaginal laser therapy for urogenital atrophy.
And what do they find?
Now, lasers do help some women by creating controlled thermal damage. They intentionally burn microscopic columns of tissue, forcing the body to rush in and heal the area, generating new collagen as a panic response.
But relying on a panic response seems inherently risky, doesn't it?
It is, and the NICE clinical overview documented some severe life-altering adverse events from these lasers. They detailed specific case studies of women whose dyspareunia didn't just fail to improve, it became progressively worse.
What?
We're talking about women who went in with mild to moderate discomfort, and after 3 laser sessions, sexual intercourse became completely excruciating.
If the NICE guidelines are documenting severe adverse reactions, why on earth are these still marketed at every med spa in the country?
Because there is a massive gap between commercial aesthetic medicine and clinical gynecological safety, lasers represent a huge capital investment for a clinic.
All right.
They buy a $100,000 machine, and they need to market it aggressively to recoup the cost. But the biological reality is that the human body does not always respond well to thermal trauma in delicate mucous membranes.
What actually happens to those tissues?
On examination, the women who suffered adverse effects had developed pelvic floor hypertonus.
Meaning their pelvic muscles were basically locked in a constant, agonizing spasm as a defense mechanism against the burns.
Yes, along with a severe vestibular burning and permanent restrictive scarring along the vaginal walls. To reverse the damage, their treatment protocol had to pivot to heavy muscle relaxants, intense pelvic floor physical therapy, and off-label neurological pain medications.
That is absolutely terrifying. You pay thousands of dollars for relief, and you walk out with permanent scarring and muscle spasms.
Which is precisely why the cutting-edge regenerative medicine community is pivoting so hard toward polynucleotides. PNs offer a gentler, infinitely safer, non-energy-based alternative.
It makes perfect sense now.
You are achieving that vital tissue repair and collagen production without relying on thermal trauma. You are feeding the cells the nutrients they need rather than burning them and hoping they heal correctly.
You are working in harmony with the body's natural biology rather than forcing a destructive trauma response. It truly is a paradigm shift in how we approach this specific, incredibly sensitive type of healing.
It really is a new era for women's health.
To bring this full circle for everyone listening, the entire clinical approach to treating dyspareunia and the genitourinary syndrome of menopause is fundamentally shifting. We are finally moving away from just masking the friction with temporary, slippery lubricants.
And we are stepping cautiously away from heavily marketed treatments that rely on inflicting thermal trauma.
Right. We are moving toward actual, profound, localized cellular regeneration. Marine-derived polynucleotides offer a scientifically backed, non-hormonal, highly elegant way to command the body's dormant fibroblasts to wake up.
They provide the precise architectural blueprints and the physical molecular building blocks needed to deeply rehydrate the tissue, rebuild the collapsed collagen scaffolding, and restore the vital elasticity that makes intimacy comfortable, safe, and enjoyable again.
It is medical science at its absolute most innovative and empathetic. But as we wrap up this deep dive, I want to leave you with a final lingering thought to explore on your own. If scientists can literally borrow the fundamental genetic building blocks from nature, like the purified DNA of a wild trout, to successfully teach our body's aging cells how to reverse localized tissue collapse and heal intimate pain, what other inevitable signs of human aging and decay are simply cellular communication errors that we just haven't figured out how to recode yet?